Hello and welcome to another interesting edition where we'll be looking at a cell injury pathology. So I'm your host Morgan Lukama Jr. So let's dive in it. Hello and welcome to another wonderful, exciting edition where we'll be looking at the cell injury pathology. So our objective for this session, students should be able to understand the concept of cells and tissue adaptation to the environmental stress, including the meaning of hypertrophy, hyperplasia, aplasia, atrophy, and hypoplasia, as well as metaplasia, with their clinical manifestation. Then we'll also look at the student should also be able to, is a student aware of the concept of hypotoxic cell injury and its major causes. Then objective number 3, we'll look at the student should understand the definitions and mechanisms of free radical injuries. Then number 4, students should be able to know the definition of apoptosis, cell necrosis, and its various types of clinical examples. Then 5, the student should be able to differentiate between necrosis and apoptosis. Then 6, students should be able to understand the causes of and the pathological changes occurring in the fatty change, that is the steatosis, as well as accumulation of exogenous and endogenous pigments. So this includes carbon, silica, iron, melanin, bilirubin, and lipofuscin. Okay, then the student should understand the causes of and the difference between dystrophic as well as metastatic classifications. Okay, so let's look at the lecture 1 outline. So in this outline, we're going to look at the adaptation of environmental stress that will lead to hypertrophy, metaplasia, aplasia, as well as hypoplasia, atrophy, and the squamous metaplasia, that is on the osseous metaplasia and the myeloid metaplasia. So we are going to look at all of these terminologies one by one as we get into this session, so that you familiarize yourself with all these pathological terminologies, because we'll be using them so often. So you really need to equip yourself and familiarize yourself with all these pathological terminologies. Then the second one, it is hypoxic cell injury. So under hypoxic cell injury, in here it is it causes ischemia or anemia, as well as carbon monoxide poisoning, which decreases the perfusion of tissues by oxygen, as well as the carrying of blood and poor oxygenation of blood. Then we also have what we call the free radical injuries. So free radical injuries, the definition that we can give is that the free radical injuries is defined as the free radical mechanism that generates the free radicals, a mechanism that degrades all these free radicals. Then we also have what we call the reversible and irreversible cell injury. So these are the cells injuries that we get to have. So to start with, we'll start with the adaptation of the environmental stress. So on the adaptation of environmental stress here, we'll look at cells are consistently adapting to their structure and function to accommodate the changing demands. That is, are the cells easy to adapt within the physiological limits? Okay. Or the other part is that as cells encounter physiological stress or even pathological stimuli, stimuli is these anything that recites a response. Okay, so they can undergo adaptation, or the principle of adaptive response that are as follows. We have the first one, which is hypertrophy, hyperplasia, atrophy, as well as metaplasia. So now you need to take note that if the adaptive capability is exceeded, or if it is the external stress is harmful, the cell develops, and then within a certain limit, injuries is reversible, and the cells return to normal, but severe or persistent stress results into irreversible injuries, and these irreversible injuries will now lead to death, and it will now affect the cells. Okay, so now let's dive into it. The first component, which is hypertrophy. What is hypertrophy? So hypertrophy is an increase in the size of the tissue or organ, usually due to the increase in the size of the cell. Hypertrophy mainly happen in an event where we have increased demand, which will lead to hypertrophy, and hypertrophy takes place in cells that are not capable of dividing. So this one, it only occurs, hypertrophy only occurs in cells that are not capable of dividing, the cells that they don't undergo cell division. An example of such cells, we have the striated muscles. Then we also have hypertrophy that can be a physiological or pathological condition. Now, let's look at the physiological hypertrophy. So, physiological hypertrophy, we have breasts during lactation. So what happens is that when a mother she's breastfeeding, what happens is that there is an hormone called oxytocin hormone. Now this oxytocin hormone, it's an hormone that is secreted by the hypothalamus, regulated by the pituitary gland, which is the master gland, and then it is transported to the targeted site. So when it goes there, then what happens is that this hypertrophy will take a place in cells that are just not capable of dividing. Okay, so now an example that I gave under breastfeeding, under breasts during lactation. Okay, breastfeeding, when a mother she's breastfeeding, this occurs during lactation. So what happens is that there is an hormone called oxytocin hormone. This hormone is produced by the hypothalamus, secreted by the pituitary gland, and then it is transported by blood, distributed to the targeted site so that it can invoke its action. Remember, what it does is that it promotes the production of the breast milk. Besides that, it also brings about the contraction of the uterine muscle in an event where we have a woman that needs to deliver during the labor time, or at labor, in the labor ward, or during the maternal periods. Okay, now then we also have the pregnant uterus. So here, what happens is that this hormone called oxytocin, what it does to the uterine muscle is that it makes the uterine muscle to contract. And when these uterine muscle contract, what happens is that then it will now lead to a normal self delivery, the self child delivery, and those are the birth methods that are mostly done. So this one, it is entirely regarded with the hormone levels. If the levels are low, then it will now result into the cesarean section. But if the levels are high of the hormone, then meaning that there will be no cesarean section, this pregnant woman should just deliver normally, and then there will be no any other outer complication that shall befall that pregnant woman there who is about to deliver. Okay, so that's what usually happens. And these are the physiological examples that I can give on hypertrophy. Now, let's look at the other one is the skeletal muscles. Skeletal muscles usually undergo hypertrophy in response to an increased demand by the exercise. So if a person is going to the gym, what happens is that their skeletal muscles, there is what we call the muscle reflex. These the muscles will undergo what we call hypertrophy. They will start developing, increasing in size. Why you find that the muscle increase in its size of the very muscle tissue or organ due to the increase in the size of the cells. Okay, so you find that these exercise they will now lead to the demand. They will demand for the increase of these cells. Hence, the organ or the tissue will now become bigger and stronger. Those are the examples under physiological. Now, let's dive into the pathological examples that borders on hypertrophy. So, under pathological, we have what we call the cardiomyocytes. Now, cardiomyocytes, these are cells that are found specifically to the heart. So these cells are called cells that are specialized cells that are found in the heart, and then these are also in form of myocardium, which are the muscle cells that are found in the heart. And then these cells, they also undergo hypertrophy in hypertensive patient. So in patients, those that are suffering with those patients with hypertension, what happens is that if you check their cardiac myocytes or the cardiomyocyte cells, you find that they are undergoing what we call hypertrophy. There is an increase in the cell mass. Okay, so that is what we call that is what causes hypertension, meaning that there is an increase in the size of the organ tissue. The muscles of the heart have increased in the size, and this will now trigger into what we call um, uh, hypertension. So it is as a result of hypertrophy in the myocardiac myocyte cells. Okay, so now this is what if you look at this cell tissue here, we have the hypertrophy of the skeletal muscles in response to exercise. So what usually happens is that in response to exercise, you see there is we have serrated muscle A as well as muscle B there. So what happened is that at A, this is an event where a person shows, let's look at it, where we have hypertrophy, which is just the absence of hyperplasia, and it is typically seen in muscles where the stimulus is increased, that is demand for work, and it is taken at the same at the same magnification. Okay, so now let's look at the comparison between these two squamous cells, between these two epithelial cells. Let's look at the comparison. So the first example here, the diagram A, it really shows the muscle fibers that are in a transverse section. So these muscle fibers are in a transverse section from the soleus muscles of a normal 50-year-old man. Okay, and then B, we have the fibers. It shows the fibers. It shows the muscle fibers from the same muscle in a veteran marathon runner. So this one, it is now showing in another individual that is a veteran marathon runner. And what we need to note from this diagram is that the diagrammatic increases in the size of the fibers in response to the demand for the marathon running. So here you can see that this cell, it has actually grown wide, like it has increased in the size of the organ. So this one, it is due to the increase in the workload, okay, the demand. So this is now hypertrophy. Okay, so it is hypertrophy of the muscles. Okay, so now let's look at hyperplasia. What is hyperplasia? So hyperplasia is the increase in the size of an organ or tissue. It is mainly caused by an increase in the number of cells. Okay, so when the cells are increasing in number, it will now result into what we call hyperplasia. So the increased demand will now lead to hyperplasia. Hyperplasia takes place if the cell population is capable of replication. So now, when a cell is in a position where it's capable to replicate, it needs to replicate so that it can produce more cells. So this increase in the cell numbers is what sponsors what we call hyperplasia. So it sponsors hyperplasia. So this can also be categorized as in physiological as well as pathologic. Okay, so now let's look at the physiological examples of hyperplasia. So the physiological example of hyperplasia, these are often seen in two types. We have the hormonal hyperplasia as well as the compensatory hyperplasia. So what is the hormonal hyperplasia? Hormonal hyperplasia, for example, that I can give a proliferation of the glands of the female breasts at puberty and also during pregnancy. So under hormonal hyperplasia, we can look at the proliferation of the glands of the female breast at puberty. So what usually happens is that the female breast at puberty, they usually undergo what we call proliferation. This is where now you find to say that the cell will start increasing in the size due to an increase in the numbers of these cells. Okay, so you find that when a girl child reaches puberty, what happens is that the breast cells, the mammary cells, they'll start undergoing what we call hyperplasia, where the breast will now grow, and then from there it will form up these materialization that will come. So this is the pathological that usually come in this format. So that's the pathology part of it. So under pathology, we usually look at the female breast, and then as well as during pregnancy, this is where now we get to find these hormone, like the oxytocin hormone. When these hormones are secreted, then we are likely to see the oxytocin levels are extracting the uterine muscles so that we can have a normal delivery. Then we have another component which is compensatory hyperplasia. So in compensatory hyperplasia, this one it is when a position of the liver is partially resected. So the remaining cells usually multiply and restores the liver to its original weight. So the compensatory hyperplasia, this one is seen when a portion of the liver is partially resected. So the remaining cells will multiply, and then they will now restore the liver to its original weight. And then we know that the normal weight it should range from 1 kg to 1.5 kg. Okay. Now, then the second part. Now let's look at the pathological hyperplasia. So pathological hyperplasia, these are commonly caused by abnormal excessive hormonal or even the growth factor growth factor stimulation. The examples that I can derogate on this one is when there is excess estrogen. Excess estrogen can lead, or it can result into endometrial hyperplasia. This causes what we call abnormal menstrual bleeding. So this is what really causes abnormal menstrual bleeding. So this one, it comes as a result of when there is just abnormal secretion of these estrogen hormone. Okay, so sometimes the pathological hyperplasia act as the base for the cancer, and for the cancer to develop from. Thus, patients with hyperplasia of the endometrium are at risk of developing endometrial cancer. So this one, it can, when it taken into some other consideration, it can even result into what we call endometrial cancer. Okay, so now this brings us now to hypertrophy and hyperplasia. So now let's look at the comparative between hypertrophy and hyperplasia. So hypertrophy and hyperplasia can occur together. So in an example that I can give here is the uterus during pregnancy. So if a person has, if a mother, she has a woman, she's pregnant, what happens is that the uterus during pregnancy, in which there is these smooth muscles will undergo what we call hypertrophy as well as hyperplasia. So what happens is that you find out that the numbers of these cells will increase, and then you find out that the muscles will now initiate the muscle contractility that will then result into these muscle, the contraction of the smooth muscles, so that the baby can now be brought out smoothly. That is the normal child delivery. This one is seen under child development. Okay, when the mother she's in the labor ward. Okay. Then besides that, we can also see another pathological, another significant example why hyperplasia can also uh, relate with hypertrophy, like in benign prostatic hyperplasia. So in benign prostatic hyperplasia, we also see the hypertrophy as well as the hyperplasia in there. So now, if you look at this diagrammatic example here, this one, it shows the pathological growth that occurs in between hyperplasia and hypertrophy. So hyperplasia and hypertrophy of myometrium in pregnancy. So now here, these are examples that are gotten from a pregnant woman. So this is just the pathological diagram that is shown from myometrium in pregnancy, and on the left is just the normal uterus. So now this is the size, this is the uterus diagram here. So this is the uterus diagram on a pregnant woman. So if you check the diagram that is found on the left side, it is the normal uterus. This normal uterus, it is showing the normal mass of the smooth muscles in its walls, and then on the right side it shows the uterus from a recent pregnant woman. So now you're going to see the difference. The normal uterus on a normal woman who is not pregnant, on a normal woman, that is just the normal uterus, and then we have another diagram that shows the uterus from a pregnant woman, from a recent pregnant woman. So now, what we can see from these two pictures is that the increase in the size of the organ, as well as the muscle stature in the increase, the muscle hyperplasia, as well as the muscle hypertrophy. So we get to see that from a pregnant woman, there is actually an increase. There is hypertrophy and hyperplasia that is being undertaken in here. So what we really need to take into consideration is that the oxytocin hormone, this one, it's a very, very, very cardinal hormone to check. When a woman she's pregnant, you really need to be checking these oxytocin levels. When you check the oxytocin levels, these are the ones that will help out to ensure that hypertrophy as well as hyperplasia is undertaken, so that when during childbirth, these uterine muscles can contract, and then we can now the woman, she can now give birth to a bouncing baby, a boy or a baby girl in those lines. Okay, so those are just some of the pathological examples, illustration that I wanted us to look at. Now this has brought us into atrophy. What is atrophy? Atrophy is defined as in the shrinkage. So it is the shrinkage of the size. It is the shrinkage in the size of the cell. This is when the cell shrinks from its normal size to its just abnormal size. So this is just the shrinkage in the size of the cell. It reduced demand. This occurs when the cell has got a reduced demand, which will now result into atrophy. So when a sufficient number of cells are involved, the entire organ decreases in size, and then this becoming atrophic. So now when this becomes atrophic, what will now occur is what we call atrophic cells. What are atrophic cells? So, atrophic cells are not dead. Okay, so atrophic cells are not dead cells, but they have a diminished function. So they usually just tend to have a diminished function, and in atrophy, there is what we call a decreased protein synthesis. So under atrophy, this is where now you find out that a cell is not, the workload has reduced. And in such cells, we have what we call a reduced protein synthesis. Now, when you look at protein synthesis, it is the ribosomes that undergoes this function of protein synthesis. So if you find out that in a certain organ, there is atrophy, what usually happens is that, meaning that there will be also a reduced intake of these protein synthesis, which will now lead to an increase in protein degradation in the cells. Then what could be the major causes? What could be some of the causes that can cause the pathological cause that can lead to that can cause atrophy? So the major cause that we can consider, number one, we can look at decreased workload or the disuse. This one, the example that I can give is immobilization of the limb in a fracture. Like in here, if a person has got fracture, like if a patient is having a fracture on the limbs, remember we've got upper limbs and the lower limbs. So upper limbs, we are just referring to the upper extremities, and then the lower limb, we are referring to just the lower extremities. And so these are the extremities that we can look at and consider. Okay, then besides that, we also have the loss of innervation. So now, when we look at the loss of innervation here, this one, it is just the lack of neural stimulation to the peripheral muscles. This is caused by injuries to the supplying nerve that can cause atrophy of that muscles. Okay. Then the other one, it is diminished blood supply. So if there is diminished blood supply, it can also cause atrophy. Then inadequate nutrition. So if an organ is not receiving inadequate nutrition, it can also result into atrophy. Then loss of endocrine stimulation. So the loss of endocrine stimulation, for example, the loss of hormone stimulation in menopause. So this one, it can only be seen in a woman that is at menopause. Now, when we talk about menopause, we're referring to a lady that has reached at the age of 45, in the range of 45 to 55 years. So that phase, it is called menopause. And it is called menopause because that lady will stop seeing her menses every month. Besides that, she will also have the blood volume will begin to rise. It will increase. Why? Because she's not seeing her menses monthly. She has stopped, and then she has reached the process called menopause. And this menopause, it is just a complete cessation of the menses. So when the menses completely cease, then the blood volume will begin to increase and rise. And when this begins to occur, then you find out that there will be some changes that will start to happen in this pregnant woman, and she can now undergo the process called atrophy, okay, which is just the shrinking of the size of the cells, okay. So now the other part is aging. So aging also results into atrophy. Aging can it can also lead to the reduced size of the cells. It can lead to the shrinkage in the size of the cells. Then besides that, we also have aging can also lead to the senile atrophy of the brain, can lead to dementia. Okay, then some of these stimulation are physiological. So some of these stimuli are physiological. Now, when we say stimuli, is just anything that can elicit a response. So now these stimuli sometimes they can become physiological. Now when we say physiological, we simply mean that the loss of hormones stimulation in menopause and other pathologic, that is divination. Okay, now let's look at evolution. So evolution, this one, it is just a reduction of the reduction in numbers, in the cell numbers. So if the cell numbers reduces, it will now result into evolution. Now we also have hypoplasia and aplasia. Hypoplasia refers to the organ that does not reaches its full size, and it is just a development disorders and not an adaptive response. Then aplasia, it is just a failure of the cell production, and it is also a developmental disorder. An example that I can give for this one, during fetal growth, we have what we call hyperplasia that can lead to agenesis of organs. So when we say agenesis now, this is just now the totally failure of cell production. Okay, metaplasia. So in metaplasia, the cell adapts by changing, like differentiating. Looking at these differentiating from one type of cells to another type of cells, and this is known as metaplasia. So here the cells are sensitive to the particular consecutive agent, and they can now be replaced in by another cell type or even better cells to tolerate the difficult environments. So in metaplasia, it is just usually a reversible, provided consecutive agents are removed. Examples include squamous metaplasia, columnar cell metaplasia, as well as osseous metaplasia and myeloid metaplasia. So these are the components of metaplasia. So if you have questions, you can ask and then follow it up. Thank you.